All right, so we're going to go ahead and get started, and I'm sure a few people will be trickling in as we kind of move forward with the webinar, and that's great. But with respect to everyone's time and Dr. Nieder's time, Erin's time with the YMCA, we'll just go ahead and get started. So thank you everyone for joining the YMCA of Alaska evidence-based health intervention programs. We're really excited to share what they have to offer today, and we're going to go ahead and get started. So this session will be recorded. We'll be able to send this out to all participants and all of those who are interested and registered today's meeting. All participants will be muted during the session as this is set up as a webinar session. And we welcome any of your comments, questions during the presentation, but please use the chat functionality during the actual presentation. But at the end of the session, we will open up the line for questions and more discussion if anyone is interested. So today's presenters, my name is Erin Ackelstead. I'm with Mountain Pacific Quality Health, and I'm an account manager, and I'm just helping facilitate the call today. Erin Widener with the YMCA, she's the Healthy Community Coordinator. She oversees and leads the Diabetes Prevention Program, the DPP program, and the Blood Pressure Self-Monitoring Program at the YMCA. We also have Vicki Levins from the YMCA. She's the Health and Wellness Director, and she leads and oversees the CARES fitness program for patients with cancer. She unfortunately last minute was unable to join us, but we will still be able to hear from Erin on her program. And then we also have Dr. Stacy Nieder with AREAT Family Medicine, and she's our provider advocate, sharing her experience today with the YMCA programs. And some of our learning objectives today are learning about the programs and referral processes for the YMCA DPP program, hearing from Dr. Nieder, our provider advocate for the DPP program, referral process and the program information on the blood pressure self-monitoring program at the YMCA, the CARES fitness program for cancer patients, and then how you can refer your patients to the YMCA programs. And I'm going to turn it over now to Erin to start talking about the DPP program at the YMCA.
Hi, everyone. My name is Erin Widener, and just like Erin said, I am in charge of the DPP program as well as the blood pressure self-monitoring program. So I'm going to share with you a little bit about the programs that we offer. Go ahead. So the DPP program is in a classroom setting, and it is led by myself. Right now, it's just me, myself, and I running the program, as well as being the life coach. It is set in a 12-month setting, meaning that for the first 16 weeks of that year, we meet every week, once a week, for an hour in a classroom setting. Following 17, 18, and 19 session, those are every other week. And so we begin to set them up to then come only once a month. I run these programs in the fall, so I start it usually at the end of August, beginning of September, and then also another cohort in January. I have found that Alaskans don't like to show up every week in the summertime. So this seems to work best for Alaska and Anchorage residents here. So the goals of the YMCA diabetes prevention program is 7% weight loss, and then building up to 150 minutes of physical activity per week. The goals that are achieved is really just behavior modification is really what we're focusing on overall. And so we do follow the CDC program that has from 2012 that has multiple different facets of conversation that we offer. So anything from stress, how to deal with stress, how to plan and organize your shopping, also how to organize and plan for being physically active before work, after work, during work, however it best suits your needs. So what to expect in class? I already said that, didn't I? 25? Yeah, so 25 sessions. So participants will receive a notebook from me. in the notebook, it has all of their sessions. So I give them a new session each week so that they're not planning ahead and looking at the sessions ahead of time. We want them to kind of stay focused every week. We also give them a Calorie King book to help them start to look at their fat intake, their calories, and their carbohydrates. And as they start to do research on their food themselves, I just started a class 2 weeks ago, and it's the first thing out of their mouth. The second session was, wow, I didn't realize how much fat I was eating on a regular basis. And she said, one of the ladies said, it's opened my eyes to already begin to eat better, just recognizing and understanding what types of food I'm putting into my body. Participants will also receive goals. So like each time they hit a goal, I give them little gifts. It's kind of just cute little things just to remind them that here at the YMCA, we're supporting them, we're cheering them on. We want them to have success in the program. And so in order for us to continue to have our CDC recognition, those goals need to be celebrated each step of the way. The program goals, like I said before, is 7% weight loss. So in the program, I've also learned that in the first 16 weeks of the program, I really encourage them to hit that 5%. So we want to start with a small goal and then reach the 7%. And I always say the sky's the limit. So if you want to lose more weight than 7%, keep on going. I will cheer you on every step of the way. So 5% is the first goal, 7% is the total goal for the whole entire year. If they want to go further down the road in their weight loss, we are cheering them on each time. Who can participate? People in our program have to be over the age of 18. Right now, the YMCA doesn't offer a program for children. That's something that we are for sure interested in the future. But the BMI needs to be greater than 25, and then also for Asians 23, which that has just recently changed. Our data has recently changed on that. So high risk tests that people take, it talks about their weight, their height, female, male. So people at risk usually it's in their family, it runs in their family, or if they have a sedentary lifestyle, people that are also, the other side of this is also gestational diabetes. So if they have been diagnosed with gestational diabetes, they have a higher risk for type 2 diabetes, as well as the blood values. It's another part of the program too. So if someone doesn't have an A1C or a glucose test, we encourage them to go and get that done so they have a good baseline. If they do not have that, we can take them into the program with just a high risk test as well. So I would probably tell you about 60% do have the blood values in our program, and the rest are at high risk. And then we do encourage them to go get the blood values done so that they do have a good baseline as they go through the program. Now they're also encouraging us to check 6 months later into the program to see if their A1C has changed since they started the program. And now how to register. So the registration, obviously, for people, they don't have to be members of the YMCA. We encourage them to come on in. Really, we want them to become part of the YMCA because one of the things that we offer here as part of the program is a free adult membership, which that in itself is worth over $744. So we want them to become a part of our Y because we don't want any other reasons for them to say, I cannot exercise, or I have nowhere to go, or it's too expensive. And part of the encouragement that we have in part of the program is to give them that membership so that they can come on in and utilize our facility however they're best wired. So I would probably tell you 50% of our classes, when they finish, they keep their membership, which is what we desire overall, because that means that they're wanting to continue to stay healthy mentally and connect with people, and then as well as physically coming in and doing water aerobics or any of our classes that we offer here, or using our fitness center. The cost of the program is $429, and oftentimes that kind of concerns people, but really realistically, myself, I have a daughter with type 1 diabetes, and I can tell you how expensive having a diabetic is. It's extremely expensive. So $429 is really a drop in the bucket in comparison to what you would be paying for insulin, medications, needles, things like that. So really, that's a small fee in the long run. But we also don't want to have people be afraid to come in because they can't afford that. So we do offer financial assistance for anyone who qualifies. We do it on a sliding fee scale. So anytime that there are companies or businesses or anybody that wants to support our program, the state is generously providing that for us as well to run these programs. But we're also always looking for people that want to donate funding for us, that we can continue to provide scholarships for people. I probably tell you half of my class right now are on scholarship. So that's always helpful to us to be able to provide this for anyone in our community. With that, we also offer a 3-month payment plan or financial assistance with the payment plan too. So if someone is on financial assistance, they can also do a payment plan as well. But they cannot just come in and register for the program. They need to meet with me first because there are qualifications, and I need to make sure that they are not already diagnosed with type 2, as well as making sure that they do have, they are qualified overall to be in the program.
Great. And now I think we're going to hear from Dr. Stacy Nieder, who's our provider advocate for today.
All right. Hello. My name's Stacy Nieder. I'm a physician at, as of September 1st, Arete Family Care instead of Arete Family Medicine. And we are a primary care family practice group. There's 6 providers and 2 PAs. And although I see a wide spectrum of issues in my clinic, my top 5 diagnoses every year are hypertension, diabetes, high cholesterol, obesity, and depression. So that's maybe where a lot of my time is focused. So I started talking with Erin, turns out quite a few years ago, about this program. And I started referring some patients to the program, and I don't know how many actually started or made it. I got some positive feedback. And then I did we have to do continuing education to maintain our board eligibility and certification. And one of those programs I chose to do was on pre-diabetes. And it very clearly states in that study material that every pre-diabetic should be referred to a pre-diabetes program. And so the problem with providing care in Alaska is a lot of time they say you should follow this recommendation, and we just don't have those services. But this is one of the situations where we have the services available and we're able to comply with kind of the national guidelines. The problem that I've seen is getting the information out to the providers so they know that they can refer to this program. So I have talked to my provider group about it. I have made an order set, so when somebody's diagnosed with prediabetes, it automatically is supposed to pre-fill with the referral. I still don't think it's getting done as often as I'd like. So I'll continue to work when we have our meetings with the providers to encourage doing this program. So I believe I have 3 patients currently enrolled in the program. And what I tell them every time is, if you don't have motivation to change, Erin has motivation for you. So of the patients that are in the program, Erin had a little bit different numbers than mine. My numbers, the first patient is a 66-year-old who's lost about 3%. And she's actually due for a recheck. I called her to come on in. It's time for another hemoglobin A1C. I have a 37-year-old whose BMI was 45.8 when she started, and her hemoglobin A1C was, it decreased by 1.1 points with the 6% weight loss that she had. And then I also had a 50-year-old whose BMI was about 40 when she started. It's actually stayed the same, but her hemoglobin A1C has dropped from 6.5 to 6.0 with no weight loss, just with the lifestyle changes. So that's, I'm sorry, I'm looking at my numbers wrong. She actually has had a 13% weight loss. I was trying to track her from before the program, but anyway, so the patients are having success with weight loss and improvements in their hemoglobin A1Cs. And that's been really encouraging, especially because if you look at there are many studies on what percentage of people lose weight. The study I quote, 6% of people who try to lose weight will have success. That's pretty horrible. 94% of people who just try, they don't have success. So if they start logging, it's about a 13% likelihood you'll have success with weight loss. And so, and the people currently from my practice in the program, we're like at 100% for weight loss, which is far above the typical norms. So when somebody comes to my practice and based on their risk factors or routine screening, they're diagnosed as pre-diabetic, I always bring them back in for what I call my pre-diabetes talk. And I tell them that I take this very seriously. And I actually call it 6 months of pathophysiology in 5 minutes or less. It's actually probably a 20 to 40 minute talk. And I go through what is happening in their system so they understand it's not because they had a cookie or a piece of cake that they have this problem, but understand more of the process. And so they have a lot less guilt associated with the diagnosis. And then I automatically refer every single person diagnosed with prediabetes to the program. There have been some challenges. Certainly, summer referrals are less likely to follow through. And then we do see the seasonal issues. And then I am now trying to get better at sending Erin an email. So with their information, I always verify that she can call them and she contacts them. And then the compliance is so much higher than when I give them a little card and they have to not lose it and then find the time to make the phone call. So I do both. Give them the opportunity to contact Erin, but also I'm trying to get Erin the opportunity to contact them. And then as they're in the program, depending on their numbers, every 3 to 6 months, I bring them back in the office and recheck and make sure that they're having some success. I like what Erin said about having small gifts. I have a little story. It wasn't my patient, but another physician, one of her patients was actually diabetic. She gave them the talk, lost all the weight, came back, not even pre-diabetic, did just such a fabulous job. And the doctor said, well, great job. And the patient said, is that it? That's all I get? And the doctor's like, yeah, what do you want? Confetti? And the patient said, yeah. So now in my clinic, when somebody gets out of the pre-diabetes range, I actually have a confetti popper I pull and we have a celebration. And so that's great. That really does help keep their motivation up. I think that so far has been a very memorable experience for all the people I've pulled a popper for. And then also it's helped when they talk to their friends, they're like, my doctor gave me confetti. And I've gotten some new patients or some information. People want referrals to the program so they too can have success and maybe get some confetti as well. So anyways, I'll continue to refer. I'll continue to try and encourage at least the colleagues I come in contact with to refer. And it is part of our guidelines. Like we need to be referring every pre-diabetic to these programs. Absolutely.
Wow. Thank you, Dr. Nieder. And talk about celebrating those wins. I mean, you know, what we may think is small is huge for them. So, wow, that's amazing. And thanks for doing that for our patients in our community. I'm sure that's really uplifting when they come see you. And it's great to hear that you're promoting kind of the YMCA programs and encouraging other providers to do so. So thank you. And thank you for sharing your experience and giving us your time today. So I'm going to turn it back over to Erin, and she's going to talk about the other two programs. So the BPSM program, the CARES program, she's going to be filling in for Vicki Levins today. And she's also going to be talking about how is best to refer to these programs. So Erin, take it away.
Thank you. So the blood pressure self-monitoring program is fairly new to the YMCA. We started it before COVID and then tried to continue to run it throughout the year during that time frame, but it became very difficult to do just because we were shut down for part of the time. So we're building it back up, which is really exciting. But as you know, diabetes and high blood pressure go hand in hand in a lot of ways. And so it is important that we are getting people to recognize that they have that they have high blood pressure, and two, that they begin to be aware of what their blood pressure it looks like on a regular basis. And so this is where this program comes in. It is much lighter yoked overall. It is really only a 4-month program when people come in, and we're asking them to check their blood pressures at home on a regular basis to be mindful of what those blood pressures are. But we do it year round, so they can enter the program at any time, and there's no set schedule for that. So anytime that they want to enter the program, they can do that as well. Now we'll go to program goals. So throughout the 4 months in the program, with the support of the HHA, so we have a couple of HHAs here at the YMCA that take the blood pressures for people. We are not doctors or physicians, so we're not going to give them any other education on their blood pressure besides the things that they need to do to make sure that they have healthy blood pressures, such as exercise and watching their sodium intake. And this is where we also do, if you see at the bottom there, attend nutritional education. So we talk about the DASH diet, we talk about shopping, how to read food labels, what's a standard number of sodium that they should be watching. And so throughout the program, because we are offering those nutritional education seminars once a month, that just helps them to have guidance in their food, how to and prepare their food during their time with us in the program. So really all they're doing is checking their blood pressures twice a month that's the expectation, but they can do it a lot more than that if they want to. Most of the people in our program are checking it at least once a day, but our expectation in order for them to be in the program has to be only 2 times a month with themselves, and then twice with us coming in and doing a blood pressure with us. So we do encourage them to do it more, and then we ask them to record it. We want to see what their blood pressures are doing. I have to tell you, a gentleman in our program has been doing it for about 5-6 months, and he's continuing, and he sends me his updates all the time. Well, where he started, where his systolic was in the red all the time, every blood pressure check that he had, and now it's in the orange. So just over time of being aware of what is going on and then taking those results to his provider has been so helpful for him to be aware of what his blood pressures are doing. And now he's almost all of his diastolics are in the green, which is a huge change from when he started the program. And that's really just him being mindful. He is exercising, and he's also in the DPP program, which has been very helpful overall in changing his lifestyle and his habits, which has helped tremendously. But the awareness has been so tremendously helpful to his physician. Who can participate? So 18 years old, must be diagnosed with high blood pressure. I even have people that come in that know that they have high blood pressure, but they have not been diagnosed with it. We take those clients as well. We also ask that they have not had a cardiac event within the last year, or they need doctor's permission to come and do the program if they have had that. Have no atrial fibrillation, also any arrhythmias. So again, if their physician says that they are in the clear, we will take them as well too. We just need to make sure that the physician is aware of them wanting to be in the program and do their blood pressure checks. And then lymphedema as well. So what to expect? So research shows, obviously, that the process of recording blood pressures at least twice a month over a period of 4 months has shown that to lower the blood pressure in many people with high blood pressure. We are seeing that across the board, which is really great. And I think just bringing that awareness, just as we even talk about with blood sugars, right? When people are aware of what's going on in their bodies, they just do a better job overall in their health. So we really want to see, even when we talk about stress with them, we talk about their caffeine intake, we talk about their food, their sodium, all the things that can trigger high blood pressure. And even challenge them to look at different time frames of their lives to see if there's something different, and then take that information to their doctors or providers to say, okay, this is what's been happening over the past month. What do you feel would be best for my medication? And that's really what we want for these people. And then enhance knowledge to develop healthier eating habits. And that's really also a big part of it. So many people in our program do both the DPP as well as the BPSM because they go hand in hand. And then also how to register. Again, it's very similar to the DPP in the sense of this is a much, it's less of a program because it's not so much of a time is spent in the program, just as we do in the DPP. This is a little bit more light yoked. The state has been so generous in offering, they bought us a large percentage of blood pressure cuffs to help us be able to run and maintain this program. So really what we're encouraging people to do is get a membership at the YMCA. And they can even get a scholarship with a membership if they need to do that or they qualify for that. And then we want them to be a part of a fitness program. We want them to be a part of our Y and doing activities and coming to the seminars and nutrition seminars. So it's a small fee to pay for all of the things that is given to them. And included is that blood pressure cuff as well too, so that they can take it home and be on point with the blood pressure. So I know what kind of cuff they're using and how it works so that we can be on the same page. The nutrition seminars, we'll start up new ones in October, and those will be in person. As of right now, we are only doing them via Zoom. And so we encourage people to be a part of those and come on in. I think once we start to go to in person, they'll be a little bit more proactive in attending. And then the CARES program, this is fairly new as well too. Our YMCA really desired right before COVID hit to put in a grant for Live Strong. We really wanted to be a part of the Live Strong program and offer that here at the Y. Then when COVID hit, they shut down all grants for funding for any programs. So the state really wanted to collaborate with the YMCA on our desire to help people in the community with cancer. So we started, it's a personalized physical and social wellness program for individuals in cancer treatment or recovery that's comprised of 12 weeks of exercise routines that you can do from home or here at the YMCA. We just began doing that. So virtually they can go on the YMCA's website and plug in their member number and utilize the YMCA's virtual classes that we offer, or even live classes. There's some of the classes that we offer live. So if they're not comfortable coming in, we want to give them options. And then there are people that want to come in, and we do offer a couple of fitness classes for our cancer clients, for them to be in a class doing physical activity with others that have been dealing with the same or something similar, and be together in a safe environment and not have to worry about other people coming in. And that's been very successful. So if you are currently undergoing cancer treatment or have received treatment in the past 5 years, you are eligible for the program. So we do have a lot of different doctors who are referring people to this program, and it's been very beneficial, and we love watching this program grow. So and then what to expect. Again, it is very, very personal. We really want to get personal with these people to help them out through this time frame. So we give them a 6-month YMCA membership. The state, again, has been extremely supportive of us in this program as we build and want to put in a grant for Live Strong. So we started building our clientele and then even our relationship with the state, which has been pretty powerful for our community. So they get a 6-month membership, fitness assessment as well with a wellness coach that can either be via Zoom or in person. Active Tracks is a personal fitness program that we have partnered with Active Tracks to be able to have people have something tangible in their hands to know what kind of fitness program they should do based on their level of fitness. 2 personal training sessions that can be either over Zoom or in person. Again, we really want to provide those people with whatever they're most comfortable with. We'll encourage them to use soup cans at home for weights if they don't have anything else, or if they're comfortable coming into the Y, we will show them around our fitness facility to best help them with their fitness goals. Healthier lifestyle and a plan in place to keep their own health and wellness a priority. And then bi-weekly check-ins and calls. Vicki, our wellness director, she calls all of the clients every Monday just to touch base with them where they at. And she really desires to make sure they feel connected and valued in and through all of this. So Mary Story, she is a local client here who wanted to share her story with y'all, so that to show you how important and valuable this is to people. So the YMCA Cares program has helped me regain a healthy lifestyle. The program has given me access to a wellness coach who holds me accountable. I have lost weight and my A1C is within normal range. The Active Tracks app for the program has been very helpful in letting me know what I should do on a daily basis. I love the different challenges that the YMCA offers. The Y has become like a family to me. And I just have to tell you, she pops into our office often to tell us how much she's rocking the active tracks. And we love to hear her share, her successes. I'm a breast cancer survivor. This December, I will finish my last surgery of reconstructive process and want to be in the best shape possible prior to surgery. My activity level and range of motion has been limited for years. However, since starting the CARES program, my activity level has increased along with my range of motion. My goal is to improve my health by maintaining physical activity and emotional well-being and quality of life. Can't ask for anything better. That just brings us great joy to see that. And then how to get started. Again, this is information on who to contact. So Vicki is our main lead on the CARES. And then I also can help direct people in the right direction too, if they contact me as well too. But this is a great avenue, and we want to provide this for everyone in our community that needs this kind of support. And the last thing that I'm going to share is referrals. So if you are looking to refer any of your clients or patients to our program, the best way to do that for DPP and BPSM is to send their information through my secure, HIPAA secure email, which is there at the top, the HCC@YMCA. This is encrypted. So anything that you send will be done encrypted and protected. Also, I have prescription pads that some of our physicians like to have in their office just to do that. So what we're trying to do is kind of have all kinds of ways to refer, to give that person no option to say no, right? So if you give them a referral, a pad, and say, hey, I feel like you would really benefit from this program, then they have that information in their hand, and then you send their information to me via email on the HCC secure. And then I have, just like Dr. Nieder was sharing, then I have their contact information so that I can reach out to them and say, hey, this doctor contacted me and said that you approved them sharing your information with me so that I can reach out and share more about this program. Oftentimes when there is that connection with them, they are more apt to join the program, just like she said. Then they know it's in their hands, and plus there is a reach out phone call. The other thing I wanted to share is, because of the summer months, one of the things that I really need for physicians to know is, say, for example, I have a program that starts in January and then it's running into the monthly sessions in the summer, and I don't have any classes starting during the summer. I still want physicians to reach out and refer people to me, because even those people, I'll give you a perfect example. There's a gentleman in my class right now who came to me at the beginning of July and said, I want to join your program, but I'm ready to go right now. What do I need to do? I sat down with him for an hour and I challenged him to start recording his food. I gave him a Calorie King book and said, really honestly, you need to start looking at your food overall and start logging, and then start exercising. And he went right out of my office and got a membership, and he lost 20 pounds before he even started the program. So that was all on him. It wasn't anything I did. It was just me sharing the information of where to start. And then he just took it on. So by the time that he starts the program, he's in a better place than he was a couple months ago. So I want that to be an option for people during the summertime too, is to give them some tools to help them along the way before they start the program. The prescription pad, like I said, and then also letters. Sometimes people will just send me letters even in the mail. I have referrals that have come in the mail as well too. So if the clients are also give authorization for me to share their data with you, their doctor, they have to authorize it, but I will send you a letter at the beginning of the class, so saying that they joined the program. I will also send you a letter at week 8 telling you how much they've attended, and then also how many pounds they've lost or where their weight is, so that really we want to have a kind of a baton pass off to you as the clinicians, to be able to kind of meet with your clients to say, oh, I see that you're doing really well and you're doing great on your attendance, but you're kind of struggling with your weight, what's going on? So that we have 2 people kind of speaking into their lives and helping them through this rather than just one. Then we'll also send you one at week 16, which also tells you how many classes they've attended, and then also their weight loss overall. And then at the end of the year, their total progress. I feel that if we are working with them here at the Y, and then you as well as clinicians are working with your clients, we feel like that is just a great way for their success to be off the charts. The CARES referral is a little simpler, really is just contacting Vicki and sharing their contact information and who the client's name is. And then she usually reaches out with them and asks them questions about their journey and where they're at. And then we usually get them into the program. So we have about 16 people now in the CARES program, which is pretty incredible to be a part of that. So thank you for your time.
Great. Yeah, thank you, Erin, so much for your time today. And it was really great to hear about all the amazing programs that the YMCA offers. And I just want to provide a slide for the contact information for Erin and Vicki at the YMCA. Also for the Department of Health and Social Services who support these amazing programs. And if you're just interested in getting more connected just for diabetes or hypertension, heart disease, there's many coalitions happening around the state. Take Heart Alaska Diabetes Coalition. There's also, you could check out the websites for Alaska Comprehensive Cancer Control Program, the partnership at the Alaska Cancer Partnership. I urge you to kind of get connected, refer to Erin's programs at the Y and Vicki's and get connected with them. And we really appreciate your time today. And thank you so much.